Hello and welcome to another United Way Partner Spotlight. Today I'm sitting down with Jeff Busher from the United Way talking the Point in Time survey. How are you doing today, Jeff?
Great. Good to be with you, David.
Nice having you here. Nice having you. Now, what is the annual Point in Time survey?
Point in Time survey is sponsored by the Housing and Urban Development, HUD. Each year, they ask each community, large cities, small rural communities, to try to get a count of their unsheltered population. And unsheltered can mean two things. Unsheltered folks may be in a facility. If they were not in that facility, they would be homeless. Or unsheltered could also mean folks who are not in a facility, folks who are actually on the street and living that way. So each year we do this count for housing and urban development, and that leads to resources and accurate funding for the programs that help those folks. This year it is scheduled for Thursday evening, December 27th here in Helena. That's the nationwide survey count. And the reason it's called Point in Time, obviously trying to identify one specific time so that we don't have overlap of people.
Gotcha.
A person who might be here tonight may be over here tomorrow night, and we don't want to count those people twice. So the goal is accuracy on this count.
Okay. Now, you say unsheltered. That's probably a term that might be unfamiliar to a lot of people. We're talking our homeless population, but it is more proper and more respectful to refer to them as unsheltered.
I try to refer to them as unsheltered. They, as I have gotten to know some of our unsheltered friends, they consider Helena their home. This is their home. This is where they want to stay. This is where they would like to find lodging. But circumstances have created such, maybe it's the economy, maybe it's unstable family situations, maybe it's substance abuse, mental health. A number of conditions lead folks to become unsheltered. And so while it's okay probably to refer to the broad category of our homeless population, I like to refer to them as our unsheltered friends, just because, and we've seen this across the country, unsheltered may mean they're living in their car in a parking lot because they can't afford a home right now. And so unsheltered really covers a lot of different situations.
Sure.
Yeah.
And like you say, they're considering Helena to be their home, so they're not homeless. They might be houseless, but they're not homeless.
Right. And they may have relatives in the area. They may have, I know a gentleman that worked in town for 40 years and currently is unsheltered. He's got a couple vehicles and he's living out of them. So it's just, it's a difficult situation, and it's not just Helena. It's across the country. We work closely with and communicate closely with our friends in Missoula, Bozeman, and Butte, who are having these same issues. And it's a nationwide challenge, and we're trying to address it as best we can.
And it seems, just from walking around Helena, and it feels like that it's a situation that's getting worse. Do the Point in Time survey numbers back that up?
They do, and we've been doing this for a number of years. I went back to 2017, just 5 years ago, and our unsheltered population was, I think that year was about 18 people. And in just last year, we had 131.
That's quite the jump.
So 150%. The count has gone up considerably. So, this summer when we saw folks on Cruz Avenue, we saw folks sleeping on the curb, on the Gulch. It doesn't just seem like it's more, it really is more people having these issues. Okay. So, yeah.
And it is fascinating to hear these numbers, but how does the community truly benefit from the Point in Time survey, though?
Because we work for accuracy, and trying to get a good number so we know what our real count is. And the way that we benefit, but based on the numbers that we turn in, HUD provides funding, federal funding comes into the state and then is dispersed to each community to help address these issues. For example, out of the United Way, we run what's called the Continuum of Care. It's a statewide program, and the United Way runs the Helena chapter of this Continuum of Care. And so each week we meet with the other providers, folks who help find housing, folks who are running our shelters. All these agencies come together each week, and we look at our list of our unsheltered friends and try to determine what next steps need to happen to help get them sheltered. So funds to run that program come as a result of the count numbers in the point-in-time survey. Also, it helps us as a local agency develop an action plan based on our numbers. If our numbers were considerably lower, we may not spend as much time working on this issue, but when we can see that they're growing and it's an ongoing problem, challenge, then we need to plan ahead. For example, recently, we had to coordinate efforts because we had 3 of our unsheltered friends develop a positive COVID response. And we had to find a place. They could obviously not stay in congregate living settings. And so working with the county, we were able to find housing for those 3 individuals. So our point-in-time survey, those numbers lead to funding that helps us address these issues locally.
And of course, it benefits the community as a whole, because I know there are probably people that are irritated by the numbers of unsheltered people that we have. But United Way and other organizations working to solve that problem by being able to see about housing these people and get them established in the community and get them jobs and where they can better be a part of what's going on. So ultimately it fuels the community as a whole, not just the unsheltered population.
Absolutely. I know we get frustrated locally, and I know we haven't done a lot of traveling. I don't think any of us have, but my counterpart in Missoula about a year or 2 ago did do some traveling. He traveled to Seattle, Portland, San Diego, Denver, and basically researching how some of those larger cities were addressing the needs of their unsheltered population. And of course, those larger cities have much higher numbers, hence more funding. And some of the responses were places like kind of a tiny home village, tent cities in places like California where that's more practical. But they are addressing these needs in a variety of ways. And as we think about those kinds of solutions, it's one thing to house the persons that are unsheltered, but the most important piece of that puzzle is the funding that comes in from the state, local, and federal resources to essentially pay for the services that help move those folks from an unsheltered situation into some permanent housing. And so when you can get them in one location, whether that's a place like God's Love or any of, which is our primary emergency shelter here in Helena, providing the services around those folks that can help move them to the next step. And sometimes you start with such simple things as obtaining a Social Security card, an ID, a birth certificate, sometimes a work permit. And sometimes as you research and help these folks with those steps, you find other issues that may need to be addressed, like mental health or substance use issues and those kinds of things. So, and because of the transient nature of their lifestyle, for example, getting mail to them. Maybe they get a Social Security card. where do they mail it if they're
Right.
unsheltered? You don't usually
You don't
have a mail.
have an address.
You don't have an address. You don't have a mailbox on your car or whatever. So places like Our Place, Good Samaritan, God's Love, those folks actually serve as mailboxes for some of our unsheltered friends so that they can move ahead in this process.
And some of the basic steps too, I'm sure, can even include like getting a shower,
Yeah.
which is a program that I
Yeah.
know that you're involved in, trying to assist with as well. At least once a week, our unsheltered population can get cleaned up and then feel better about themselves, maybe feel better about doing a job interview and
bet.
helping to solve some of these problems for themselves. Because I know that a good portion of the homeless population, they don't want to be that way. We might want to assume that they're all a bunch of drug addicts or mentally challenged people, but that's not the case. Sometimes it was just.
It's not. And I haven't bought a new car recently, but they still don't have showers in them. So,
Yes.
So a lot of our friends may be in campers or in their cars or staying in a shelter. And the good folks at St. Paul's, when they built that building on the lower level, have great shower facilities, and through a partnership with Good Samaritan Street Outreach Program, United Way, and St. Paul's, each week we're providing showers for those folks, and they appreciate it so much. It gives them some dignity, and as you said, whether they may be looking for a job or going to work or whatever, that weekly shower, we've kind of developed a relationship with some of these folks,
Right.
and gotten to know what I'll call some regulars, and they joke and they say, "Okay, I'll be back. See you next year," kind of thing, and they appreciate it, and we've it's grown to the point where we've got a couple of volunteers that bring donuts, and the church offers some coffee, and it makes for just a really wholesome and helpful, very practical thing for our unsheltered friends. Yeah.
Which is awesome. Now, I suspect there are different components to the point-in-time survey. I mean, there's the obvious gentleman that's sleeping on the park bench, but we also include unsheltered people that are living in facilities like God's Love, or that may be sleeping on somebody's sofa. How does that work out?
Yeah. In fact, this week I am sending out information to the two components are the sheltered count and the unsheltered count. So sheltered count would include folks who, for example, are staying at facilities at the Salvation Army, at God's Love, any what we call either emergency shelters or transitional housing. Also, the YWCA has transitional housing. So any of those places down in Clancy, the Hope Center, folks who are in these facilities but are deemed, even the jail, we include the jail in this because the question we ask is, if this person was not currently in your facility, would they be unsheltered? Would they
Right.
be homeless? And based on that criteria, the folks in these facilities are able to kind of go through their roster, and if that person has a permanent address, then they would not count as unsheltered. If they do not, then they count them in that sheltered count. And it's called sheltered because at this point in time, that date, they have
had
a
a
roof.
roof.
They have a roof over their head. And so that's the sheltered piece. The unsheltered piece is probably the piece that gets most attention, and it's the piece that requires the most work and volunteers. We have already had a couple of meetings with folks who know the community well, and we've got a map where we have identified locations around town that unsheltered folks find themselves spending the night. Stairwells sometimes down on the gulch, certain buildings, campgrounds, things like that around town, and we've identified nearly 20 locations. And in fact, in an effort to be as accurate as possible, I would even invite folks who know of places where unsheltered folks spend the night, drop me an email, give me a call at the United Way, so that we can have the best accurate count we can. If we know of a place that's not on our map, you know a certain person is sleeping in a camper or a truck at this location, and they may not be on our radar, then I would ask folks to please let me know that so that we can get them counted.
Sure.
Because again, the accuracy of the count is very important.
And it's a whole domino effect, you know. It's
It
like
is.
we get this count, we get a little bit of money, we can help some of these people, we can reduce the count.
Yeah, yeah, and you know, I mentioned the FUSE program, and I'll just mention briefly. FUSE stands for Frequent Utilizers of Systems Engagement, and what that means is some of our unsheltered friends are high users of some very expensive resources in our community, like the emergency room, ambulance calls, law enforcement encounters, jail stays sometimes. Those, and they have no way of paying for those resources. So as a result, the blessing gets passed on to the rest of the community. And so by identifying those frequent users, we can help to draw down the costs across the community and get those high utilizers the resources they need to get them sheltered and get their life stabilized so they're not utilizing emergency resources as much. So it's kind of another ripple effect of this count is identifying those folks and getting them the help they need.
And as you're identifying them, what's some of the questions that you might be surveying them?
Yeah, the survey is interesting. Last year, due to COVID, we did what we called an observational count, which was very simple. We drove around, identified a male, middle-aged, you know, and just were able to count that way. Did not do an actual interview. That was the first time, and it was obviously due to COVID. And we may, it's not January 27th yet, we may get a directive to do it that way again this year. But currently, the anticipation is we will conduct an actual survey. And by the way, we invite our unsheltered friends to participate in this survey, and we give them, we often have gift cards, socks, gloves, hats, things that we can thank them for their participation in the survey with. But some examples of questions are, you know, how long have you been in this community? Where did you sleep on January 27th? Where are you sleeping tonight? We don't ask their name, we ask their initials. We ask them for their age. We ask things like their gender, their race, if they have any income. And some do. Some have Social Security, some have disability, some, you know, so some folks have some limited resources. We ask, how long has this current episode of homelessness been? Has it been a month, a week, that kind of thing? Is this your first homeless experience? Do you have, or have you ever had issues with mental health, substance abuse? Do you have disabilities? And, you know, there's a total, it sounds like a lot, but it takes about 6 or 7 minutes to ask these questions. This year it's all digital. Folks will have iPads and we'll have smartphones with the questions on it, and it's a very simple yes or no, very simple questions. But there's about 27 questions we ask. And sometimes if we're working with a household, maybe there's a couple or a couple with a child or two, we try to address those questions by family, so it's not terribly repetitive. So yeah, those are the kinds of questions we ask. We try to make it as unobtrusive, as simple as possible, but at the same time try to collect this data, again, so that we can address the needs these folks have.
I know it probably can be quite a bit of a challenge because not all the unsheltered are very trusting of people they're not familiar with.
Well, it is, and that's why our folks at Good Samaritan, who have a street outreach staff, folks at Our Place, folks at God's Love, these are some of the folks who help us with this count. And we send those folks into the places, into the identified spots where we know there are going to be some people, and they already have relationships with these folks. So it's not just some random person asking them questions. which can be off-putting for any of us.
Sure.
But we try to utilize folks who have some relationships with these folks. But even, as I said, even the volunteers, and by the way, we are still recruiting volunteers. We've got a pretty good handful of folks willing to join us on that Thursday night. But they can go through volunteerhelena.org to sign up for that, or they can contact me at the United Way to volunteer. But these volunteers go out in pairs. We try to be safe. We'll be masked up, try to prevent any COVID transmission. But again, friendly. And folks, and obviously our unsheltered friend can also refuse to answer the questions. We try to count those folks who do refuse because they're still out there. But we just may not get as much data on them if they refuse to answer the questions. And that's okay. That's their call.
Sure.
So yeah, it's an adventure, but it's a valuable resource that we rely on from year to year.
It's going to be a big night. And those volunteers don't really need to have any prior experience or anything coming in, just a willingness to want to help. Because like you said, the questions are easy and it's all done digitally. Yeah,
that's true. There is. We go over a couple things before we send them out. And there is a required training that is online. They can Zoom it either the Monday or the Wednesday before the count. I think it's 10 a.m. and we send links out to our volunteers so that they can get some familiarity with the process. But very simple, and usually folks are out less than an hour. Hopefully the weather will cooperate, but whatever the weather
Montana.
is, it's that night, whatever the weather is.
Sure.
So, yeah.
Sure. Well, thank you so much for joining us today, Jeff.
You bet.
And thank you as well. And we look forward to seeing you again for another United Way Partner Spotlight. Goodbye.